everybody, it's Martin Kiernan here. Before we begin, we have a small favour to ask. Infection Control Matters is produced independently, and unlike many podcasts, we don't advertise, and we don't have any marketing budget or anything like that. We also no longer use X to promote any new episodes, so the best way for people to discover the podcast is through listeners like yourselves. If you find the podcast useful, please consider telling a colleague or one of your peers, sharing an episode with your team, or even mentioning us on social media. Please also remember that we've got a podcast website called infectioncontrolmatters.com, and on that you can search for categories of podcasts on particular topics. Thank you very much for listening to that. And now on with the next episode.
We're back again for another round of poster walks and talks, and there were some great ones in the first little session, and hopefully we can bring you a few more in this podcast.
Walking around the exhibition, Brett and I, and we didn't have to go far because it's only 2 places away from your poster, Brett, found Aline Wolfensberger from Zurich, who's got a nice post on patient partnership for prevention, co-designed solutions to engage patients and relatives in non-ventilator associated pneumonia. So this is a nice piece of co-design and getting design people involved. Tell me about how you went about this particular piece of work.
So the idea that this is important that we engage patients and relatives came from our project that was carried out 5 years ago. Mm-hmm. We realized that patients and probably their relatives can be interesting and important partners, for example, or especially for oral care and mobilisation. So we then formed a study team, including people from the Institute for Design Research and 2 patient collaborators, and we followed the human-centered design approach. So we did a mixed method needs assessment first. We did interviews, we did observations on the wards. Then we did several co-design workshops with various stakeholders, patients, family representatives, healthcare professionals, designers, psychologists, and we prototyped these solutions and in the end finalized the products based on feedback.
The results of the needs assessment, the interviews was quite interesting, the barriers. I mean, the lack of knowledge about the preventative role of toothbrushing, but what about the unfamiliar, uninviting hospital environments for oral hygiene? What was the aspect of that?
That was more for mobilisation.
Right, okay.
So people told us, hey, I don't want to leave the room. I get lost in this hospital. I don't have space to be outside of my bed, to sit in a chair. So this was more the mobilisation barrier.
Okay.
And so for the mobilisation barrier, you had some solutions for that. Do you want to tell us about those and the oral care ones as well?
Yeah, we came up with several solutions, I think 5 or 6 for both oral care and mobilisation. The one that was particularly appealing to patients was a flipbook display with exercises for 3 different types of patients, for bedridden patients, for patients who were able to move in the room, and even for patients who could leave the room and be on the ward. And there we had exercises they can look at and do, like breathing exercises, simple exercises, sit up, do some steps, etc. And people like that a lot.
That's very simple, isn't it? I mean, often you get on a plane and they'll say, this is what you do to stretch your calves out to stop you getting a thrombosis. So, okay, that was interesting. And the discovery map as well.
The discovery map.
Yeah, that was for patients who were able to walk quite far distances. Our hospital is quite large, and then we suggested some, maybe 10 places that a specific piece of art is, or a balcony they have a view from, and places they could go to and visit and get some
and get some exercise on the way. Okay.
And the motivational chair sticker, what does it say?
What is that?
On there?
On the chair sticker it says it was meant more for relatives, so before people take the chair and sit to the bed of the patients, we hope that they would look at the sticker and read, hey, why don't you go for a walk with your patient? Better than sitting next to the bed of the patient, take your patient and go for a walk with him.
Oh, I like that.
That's really good. And then your oral care solutions, you had some bathroom mirror stickers?
Yeah.
Yeah?
information, toothbrush cut, and the napkin. Yeah.
Yeah, so that
The
was,
napkin's a good one. Did you include hand hygiene on the napkin as well, or was it just?
it wasn't just oral care
Okay.
here in this example. So we thought that when serving a meal would be a good time point to remind people to brush the teeth afterwards. So this was the napkin idea, and the toothbrush, the sticker was on the mirror in the bathroom. So where people brush their teeth, some information that brushing teeth is also important to prevent pneumonia.
Did it have any message on it that said, "Don't leave your toothbrush on the side of the sink, otherwise you're going to pick up gram negatives from the previous person"?
No, but good idea.
Well, on the informational napkin, there's a QR code. What does that link to?
So this links to a one-page information about the importance of toothbrushing and some basic information about pneumonia.
Do you know if people access that? Can you get any data on that?
We did take a look, but it was not accessed that often.
Oh, okay.
Unlike your website, man.
No, but that was part of a study there, so it's slightly different, really.
So are you going to write this up, Aline? Yeah.
Sure.
Yeah.
We are in the writing process.
The beauty of posters, and this is a great example of that, is you can visualize this so well. Hopefully we could describe what you did to people, but when you look at the images on posters, they're so powerful to be able to see the different things you did for mobilisation and for oral care. Yeah, there's real value for that.
But I really like the mobility aspects of it because, you've done the work on oral care, but mobility is another key thing. And I did wonder about, could anybody do an RCT actually on, we're going to add in a minimum amount of mobility and normal life. But anyway, there we are. Right, well, thank you very much for chatting to us. It's possibly under duress, but anyway.
Thank you
very much. Brett, you found something different.
This is why I like posters. I mean, we've seen plenty of really good examples at the conference, but here's one that was a little bit left field. And the aim was to try and help understand and promote scientific communication, and it was just trying to work out what the viewpoints of a researcher might be versus the viewpoints of a journalist. And they decided to do a sort of a joint residency program to bridge this gap and understand a researcher and a journalist getting together and doing a 4-week reciprocal immersion in each other's settings. And it was a television journalist, and it was a journalist from an infection-based research centre. This immersion process revealed big differences between, I guess, their viewpoints. The journalist noted highly specialised long-term solitary nature of research work.
Oh, the loneliness of the long-distance researcher.
Yeah. And then the researcher observed the fragmented, time-pressured environment of journalism. And I like, so some of the themes, the barriers to collaboration from the sort of journalist point of view was hard to pick a sexy topic, hard to find a researcher who comes across well.
That's an interesting point, isn't it?
A researcher who comes across well?
Yeah,
sexy topic? Both.
No, the researcher who comes across well.
Yeah.
Hard to find a contributor at short notice, and their deadlines
just actually being here, this conference, yesterday, I had a request from a journalist in Australia to comment on something. Probably took me 3 hours to get back to them because I just was busy with other things.
Yeah, it's done.
And it was done. It was too late.
Yeah.
So challenges in conveying complex topics within a few minutes and a few lines.
Yeah.
And then the researcher.
Yeah, I'm not legitimate if I'm not the official expert of the topic. Well, that was rule me out of talking about anything then. I will have to make rough shortcuts. Being in the spotlight does not look professional, which is, I can get that.
Yeah.
And that's possibly because of those who do go in the spotlight. I don't know. I'll lose my time. He wants sensationalism. Yeah.
And so as a result of all this, they said to raise awareness through this shared discussion. They shared their findings at conferences about different perspectives and how you might communicate better, presumably, and vice versa. They've developed a comic book chronologing the residency. I'd like to get that. And
I'd like to see that.
Yeah. And they did a podcast.
And they published an article on it, so that should be quite interesting. Yeah.
Yeah. So the
podcast, unfortunately, is in French. Otherwise, we can put a link on. But
we can put a link on, in case there's, if we can do that. And the conclusions were to shed a light on the importance of stronger researcher journalistic interactions.
and looking at the barriers on both sides. It's nice to look at from other perspectives, isn't it?
it is.
Is this
your poster?
No. Okay. So we thought we'd had the author then.
Yeah.
Okay.
Yes. Yeah. Interesting poster.
Yeah. It is nice. Okay. We're now at a poster from Nicholas Helson's. It's an assessment of a peer-to-peer collaboration needs of across IPC professionals in Europe. So this is an EU JAMRA 2 initiative, and we'll stick a photograph of the poster up on the podcast if that's okay. Nicholas, what did you do with this? Because I heard yesterday at the UKIC meeting that trying to get peer support is difficult.
Yeah. So the point was to lead a little bit of an investigation across EU JAMRA 2 partners in the work package 7, which is focused on IPC. And so we wanted to have a little bit of an overview of what the partners, actual IPC practitioners, so nurses, doctors, etc., were expecting in terms of training, because we know that the IPC training across Europe is very variable.
Very variable. Yeah.
And so it's a little bit the same idea as the UKIC certificate program, is to harmonize what everyone knows and what everyone can do. And so the idea is to lead peer-to-peer activities, and to start that we wanted to know what people expected and what they were most interested in. And so we led an investigation, an online questionnaire with different topics, but mainly the idea was to know which topics they were most interested in, which format, peer-to-peer training format would they find the most valuable. And also one of the main results is the fact that a lot of them, which is expected, but it was interesting to have a number on them.
Yeah.
Almost half of respondents didn't have the fundings to perform peer-to-peer training by themselves.
Right.
And so even the institutions were not able. And so it means that we need to mobilize some fundings from EU JAMRA to help them, because the problem is that most of the time the people who comes from countries or institutions who don't have fundings to finance trainings also are the one with the most heterogeneous training. So
and they're after mentorship, because that's the activity they wanted most, which means they want support from their peers.
Yeah, of course. And
mentorship's hard to do over webinars and things like that. It's a different.
But it's also like we have done a few mentorships, and it's not very difficult to implement. So it's good that it's the one that they think is about valuable, because it's only an exchange of email, sometimes a web conference or whatever. Yeah. So it's quite easy to implement. So, and it's also very valuable. In a very short time span, you can extremely rapidly change the behaviors or the view that some people have. I think also what is interesting is that we were able to have most of them were actual field people. So it's not, because the problem of EU JAMRA is that it's a lot of politics and a lot of very high level with quotation marks, with very high institutional people, and we are not interested in the opinion of people from the ministry and from the higher authorities. We want the opinion of people from the field, the nurses, the doctors, and stuff. Yeah. And so we were able to reach them, and that's what we were most interested about.
And they were interested in a range of IPC topics, but it seems like gram-negative resistance and resistance-related topics were the hot topics.
Yeah.
High priorities.
Interestingly, pneumonia isn't on it.
Pneumonia's not on there, no. Bloodstream infections, intravascular devices, and lower down was epidemiological methods and transmission-based precautions and hand hygiene.
Yeah. Interesting.
Yeah.
And also there was also a possibility to suggest topics. Yeah. And a lot of them were about AMR. Candida auris, gram-neg, Acinetobacter.
Yeah. I'm interested to see you got respondents of microbiologists, infection controllers, but also IPC practitioner.
Yeah.
So were they not a doctor or a nurse? What were they?
It's It's good. It's difficult. I think this one is more like a general terms that we use because there was a lot of people who work in IPC but don't have like the how do you say?
A professional
They
role.
have a training and they have, but the title is not conventional. I would say.
Okay. Yeah, okay, gotcha.
So it's
yeah.
something that we said to. They work in APC. They are fit people and they end dirty, but they are not.
I know in some countries IPC is often led by theatre or So okay, that'd be them. Okay, well thank you very much for
your
chatting to
time.
us. Thank you.
Cheers, thank you.
Well, that's the end of it. The posters for us. I mean, it's exhausting going around them all because
It is.
it's so many good things and interesting things.
And it was a great turnout. There was a lot of people jammed in to the session. It's hard to move around the posters. It was great to see that much interest in posters and a lot of people staying in front of their posters and very happy to talk about them.
Yeah, I mean, and we see the papers that are going to be appearing over the next sort of 6 months to a year. And we also see early career researchers and people starting out on their PhD journey. So it's always good fun chatting to folk like that.
It is.
It's been great.
Thanks, Martin.